Well, I believe RA Warrior is the largest website on the internet for the condition RA, also known as rheumatoid disease or rheumatoid arthritis. And there's a blog there. We have about 600 pages on the website where we talk about new research and the symptoms that patients experience. And we have at least 15,000 comments from patients directly interacting with the content on the blog. When I was diagnosed back in 2006, whenever I would look on the internet for information, it was very difficult to find information that was relevant or hard to understand, and a lot of the information was conflicting. And then the more I interacted with patients, I learned that the information I was getting from patients also conflicted with the information that was reported on a lot of health websites. So I decided that I would become a patient reporter and report from myself what the disease experience was like, but at the same time try to bring the research directly to patients in a language that they could understand so that they could access it too. I decided to attend ACR last year for the first time as a patient with a press pass because I wanted to come right where the researchers are and learn about what they're doing to improve our lives and to bring us better control of our disease and to help improve our mortality rate and be able to bring that hope directly to patients across the country and across the world. We're here for the second time with the press pass, but we actually did break ground this year in another way because we founded the first nonprofit for RA patients and by RA patients. So we now have the Rheumatoid Patient Foundation exhibiting here at ACR this year as well, so that we can also bring the patient face and the patient voice to the people who create our care. We want them to better understand what the experience of the disease is because the arthritis is really only one symptom of the disease. And so we want them to understand how much we really need better treatments and how much we need to see different kinds of specialists and help to coordinate our care so that we can be as able as possible and live as long and healthy as possible. In some ways, it's like being sick and having the flu most of the time because we have a lot of fatigue and stiffness, we have fevers, things that are hard for people to understand. So it's better if we try to relate to things that they know, whether it's having the flu and feeling really weak and fatigued or possibly having a sprained ankle. Most people have had tennis elbow or, carpal tunnel in their wrist or a jammed finger. We have those experiences all over our body all of the time, and we live with that and manage that, in addition to the fact that most of us also have a lot of comorbidities or secondary diseases that come along with RA, things like Sjogren's syndrome. So we have dry eyes and dry mouth. We might have a hard time chewing our food, even if we can cut our food. So it's a very frustrating way to live, and most of that is invisible to people around us, even to our caregivers. We are soon opening membership for our new foundation. It's a completely separate entity. Our nonprofit is at roomforus.org, and we would love to have open membership for physicians and for industry and for patients to communicate together and work together to fight this disease.